Hi, I'm Dr. Matt Sheehan from Medford Family Chiropractic Center in Medford, Oregon. And today is January 2018, and I'm here with my friend Julie. She's going to help us to go over some exercises today. And the one I have outlined for this particular video is safe sit-ups, or McGill's crunch is another name for it. And the reason we are going over a different way to perform a crunch is basically because we now know that old school ways of teaching a crunch are not ideal for the low back discs. So let me just show you what we're talking about. So this is a model of the human spine. This is the back side. This is the front side. This is a normal healthy curve in the low back. Ordinarily, when we've been taught to do crunches over the years, we would start out flat on the back like this, and we were taught to flatten the small of the back out like that. And keep it that way. Keep the abdominals tight throughout the whole exercise, and keep that low back flat against the floor, thinking that that was going to work the abdominals a lot more efficiently. But the problem with that is, as you might be able to see, as this flattens out, it transfers a lot more pressure or weight bearing onto the discs. And over a period of time, that could be deleterious to the health of the discs. It could cause them to bulge or to wear out. So we don't want to do that. Now what we want to do is we want to maintain a normal, healthy curve throughout the performance of the exercise. And we can do that and still concentrate the exercise on the abdominal muscles. And how we do that, Julie's going to demonstrate this for us now. And just so you know, for the sake of my patients, this is the handout we're referencing. If you're holding it in your hand and saying, I don't get how to do this, I need something else, this is how you do it. Here is a view of the relatively normal curves of the spine. And so from this perspective, what we are talking about when we're doing a safe sit-up or a safe crunch is we just want to maintain this alignment while we perform the exercise. So it'll be like this, and then we'll be crunching up like this while we maintain the curves. And Julie's going to demonstrate that for us now, and I'll talk her through it. We're going to have Julie demonstrate how to do a safe sit-up for us. So Julie, I'm going to have you lie flat on your back for me. And I'm going to have your knee bent perfectly, just like that. That's great. Now, to maintain the curve in the small of Julie's back, what I'm going to have her do is put her hands one on top of the other like this behind your back, in the small of your back. There we go. Stacked one on top of the other. Does that feel okay?
It does.
Okay, good. So that's maintaining that curve. And now what we're going to do is we're going to have you, Julie, imagine that there is a weight scale, like the kind we step on just to weigh ourselves every day or whatever, if we ever do that. And imagine that's under your chest behind you. And what we're going to do to engage your abdominals is, first of all, we're going to have you clench your gluteal muscles, and then engage your abdominal wall right here. Good. And now what you're going to do is you're going to tuck your chin just a little bit, and you're going to lift your elbows just so you don't cheat and use your arms to push you up. And that's important to remember, because it's easy to do that without even realizing you're doing it. And then what you're going to do is you're going to lift your torso, and you want to keep your neck and your head in line with your torso. You don't want to jut your head out, because you'll strain your neck if you end up doing like that. So try and keep your neck and your head in line with your torso, and then you're going to lift all the way up. And there you go, until you feel, okay, go back down. So you're going to, as you lift, you're going to just lift far enough to feel as if the weight scale is unweighted. Typically that's lifting till about right down here, okay? And as you come up, the rhythm is going to be coming up slowly on a scale of a count of 3. So you're going to come up like this: 1, 1,000, 2, 1,000, 3, 1,000. So by the time you get up that far, to feel like you're unweighting the scale, you're at 3, and then you hold it for a count of 3, and then you go down for a count of 3. So it's pretty slow, but basically what you want to remember with all these core exercises is that if you can't do it slowly, We got no business doing it quickly. Okay? So it's all about motor control, meaning control of the muscles, and getting to the point where the muscles can work slowly and really smoothly and not with a lot of ratchet. A lot of times when you're starting out with any of these core exercises for strength, you're gonna be doing it and it's gonna feel ratchety and kind of jerky. That's because you lack motor control. So as time goes by, as you do this, you'll get a lot better, a lot more smooth performance of the muscle, and that means the coordination of the muscle from the brain is becoming much more efficient, and that's what we want. So elbows are going to be up, so you're going to come up slowly. Come on, 1, 1,000, 2, 1,000, 3, 1,000. Try to bring your head back if you can. Is that okay there? Mm-hmm. And you hold for 3, and then you go down. 1, 1,000, 2, 1,000, 3, 1,000. Good. Okay, and you would you basically repeat that as soon as you touch, as soon as your head touches, you come right back up. You don't stop at all. Okay, 1, 1,000, 2, 1,000, 3, hold, 1, 1,000, 2, 1,000, 3, 1,000, 1, 1,000, 2, 1,000, 3, and then you would repeat, bang, come right back up. So you're good. That was perfect. And did you? It looks a little shaky. You feel it? It's tough, isn't it? Mm-hmm. There we go. So that's how you do safe sit-ups. And what you want to remember with the strength exercises in general is you want to do, at least this is how I do it. There's a lot of discussion on best ways to do this. This is how I've done this, and it works well, to have you basically do them until you're starting to feel some pretty significant fatigue, or you start to get to burning, and then you can quit and wait 30 seconds, then do another set. And ideally what I have people do is do 2 sets in the morning, 2 sets at night, not every day, but every other day. That's a standard way I have my patients do them for strength exercises in general, and with stretches, I really want you doing those every day. Common questions. How do I breathe? I want you to try to just breathe normally. Breathe in your abdomen, not way up in your chest. Try to allow your belly to stick out both front to back, but also sideways in the ribs this way. Just concentrate on that as you're doing performing the exercise. And people always say, so what about the knees? Can I switch knees? Yes, you can do 1 set with the left knee bent and 1 set with the right knee bent. Okay, so that's fine. Thanks. If you have any questions, feel free to give me a call, 541-773-1321, and have a great day.